Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I'm sorry I had to take last week off. As many of you know, I actually had quite a severe migraine headache, actually, and I don't think I would have made too much sense. But it's good to be back here again this week with you. For those of you that are new to the webinars, you create these webinars with your questions. Those of you that have been here before know that. And the way you write your questions to me, there is a chat box down at the bottom, right down there on the right-hand side of your screen. You want to go ahead and write your question to me. I only ask that as you write the question that you only hit the enter key when the whole question is complete. The problem is if you do the enter key to create paragraphs while you're writing your question, what it does is it creates multiple questions on my end that get to be hard for me to manage, okay? During the webinar tonight, I'm going to display those questions to you, but I'm also going to read them. And the reason I do that is in the recorded version of the webinar that many people watch the day after, those questions don't display. They only display to you if you happen to be watching the live version of the webinar tonight. So I am creating a recording of this, and tomorrow morning, in the morning, I will send out an email link to you that gives you the information about the recording being done. It also will have a link in it that you can use to sign up for the webinar next week as well too. So we're having a webinar tonight, and then we'll have another webinar next week, okay? The email that I just told you about should be available somewhere around 6:30 in the morning Seattle time. Keep in mind that's 3 hours different than the East Coast here in the United States as well too, all right? So without any further ado, let me go ahead and get over here to the screen where I can see your questions. I'm going to jump in and get going here, okay? All right, so first question here is from Oscar. Hi, Oscar. Let's see. I've been on 9 months of antibiotics for Lyme, BART, and Babesia. Still have heart palpitations, shortness of breath, and twitching. On the small chance this is due to something else, any evidence for what else I can check? Hormones, mitral valve prolapse, etc. So, Oscar, in terms of whether this could still be something else, the muscle twitching is, I'm not aware of other diagnoses that really are going to lead to muscle twitching other than something called Lou Gehrig's disease, or also known as ALS, okay? But I suspect somewhere along the way your doctors have considered whether you might have that, and that's already been tested for. In terms, and the way you would test for it, depends on what your whole neurologic symptoms are. So if you have enough neurologic symptoms that look like ALS, they should test for it. And the testing for ALS is to do something called a nerve conduct, or a EMG, where they stick needles in your muscles and run electricity through it to see what happens. So that's the testing that would need to be done, but I rarely does that happen in this disorder. And usually, if you're 9 months into it, if you still had ALS, you would be getting worse probably, okay? Well, actually, you might be getting worse if your Lyme isn't getting better, I should say. All right. In terms of palpitations and shortness of breath, you know, the main thing that could cause it would be an electrical conduction problem of your heart. So somewhere along the way, somebody should have done an EKG or something called a Holter monitor, where they hook up wires to your heart or your chest to measure the electrical activity of your heart and to see if you've got skipping around, okay? So somebody should have done that. If you're still having palpitations, sometimes they might want to do a cardiac echo, an x-ray of your heart to see if you have this thing called mitral valve prolapse. You might want to do hormonal level checks, as you suggest, looking at thyroid level. Beyond that, probably not much. Maybe a chest x-ray. If they should at least listen to your lungs on exam. And if they hear things, they might want to get a chest x-ray just to make sure if you're having any lung problems that would be contributing to the difficulty that you're having. But those would be the things you might want to consider doing. Okay? All right. Thanks for that question, Oscar. All right. Normally I only take one question per person, but I'll do a second one from Oscar here. Let's see. You've said that when people seem to relapse, it's often cytokines from yeast overgrowth. But if the places that hurt again are the exact same places and in the same way that Lyme and co-infections bothers me most, does that mean it is in fact a return of my Lyme, BART, or Babesia? A good question. So many of you may be familiar with the fact that when somebody relapses after they've been doing better, the one thing I ask people to be sure of is that it's not too many yeast living in your intestines. All right, now that may seem kind of strange that I would equate yeast with Lyme, but let me talk about why. So as many of you know, when somebody has Lyme disease, the symptoms that they actually have are symptoms that are due to too many inflammation chemicals made by the immune system called cytokines, all right? So white blood cells, when they see Lyme or they see yeast or they see other infections, make these chemicals called cytokines, and they're good and bad. On the good side, cytokines cause more white blood cells to be made. They draw those white blood cells where the infection is, and they help the white blood cells work better. That's all great. But at times, the immune system doesn't do a good job of getting rid of your Lyme or getting rid of your yeast or getting rid of your mold toxins. And what it does is it makes too many cytokines. And too many cytokines make it so you can't think. They cause hormonal dysfunction. They give you body pain. They give you fatigue. Basically, all those symptoms that we call Lyme disease symptoms, which often look very similar to yeast symptoms, which look very similar to mold toxicity symptoms, are due to too many cytokines, okay? So, in my experience, what I see is that about 80% of the time that somebody is doing better, even if they're in the middle of a Lyme treatment and they get worse, or if they're in remission and they get worse, about 80% of the time in my experience, it usually is that too many yeast started growing in the intestines. And those too many yeast released or cause the immune system to make more cytokines, which can make it look like your Lyme came back. To answer your question, what tends to come back are the same symptoms that Lyme causes, actually. So even pain in places that Lyme caused can be made worse because of having too many cytokines produced as a result of having yeast in your intestines. So yeah, it can literally mimic exactly what your Lyme looked like. The yeast can look very similar to that. Now, clues that it could be yeast are increased sugar cravings, gassiness or bloating. Sometimes acne or skin rashes get worse when you have too many yeast, and it's because there's toxins that get released by yeast that interact with your skin and make rashes worse and can make acne worse, okay? If you're a woman, you might have vaginal itching or vaginal discharge. Sometimes people have difficulty swallowing because things feel like they get caught in the food pipe. All right, so there's usually some signs or clues that it could be yeast. And if you have any of those clues, I suggest treating for yeast before you jump back into a whole Lyme treatment. Again, that's based on my experience. This is what I see about 80% of the time. Okay? All right. Thanks for that question, Oscar. Good luck to you. Hello, Sue. Let's see. Thank you for these terrific webinars. You're welcome. And hope you're feeling better. I am. I get migraines occasionally, and they can take me out. So I'm glad to be feeling better. I recovered pretty quickly the next day, actually. Thank you, though. Let's see, apparently Hashimoto's and hypothyroidism have similar symptoms to Lyme disease. How do you tell the difference between Lyme and thyroid disease? Also, if going dairy-free, is milk kefir allowed? So regarding the kefir, sometimes you can get away with kefir, sometimes you can't. It depends on for what reason. If you're trying to do it to avoid calcium, because calcium can decrease absorption of doxycycline or minocycline, for instance, I would avoid kefir. Otherwise, you might want to try kefir or take it out and then reintroduce it and see if the symptoms that you're trying to eliminate by being off dairy get worse when you put the kefir back in. Then you know you got a problem. But you got to be off of it for at least 3 weeks to do that kind of a challenge, for that challenge to work correctly, okay? In terms of hypothyroidism mimicking Lyme, there can be quite a few differences, actually, okay? So typically with hypothyroidism, you're not going to see, you may see low energy, you may see achiness, you're going to see lower body temps, and you may see hair loss, and you may see weight gain, okay? Those are kind of the symptoms I think of with low thyroid. Lyme, on the other hand, can give a lot of problems with neuropathy, can give probably more severe muscle achiness than you get with thyroid, can give mental confusion, can give insomnia, which usually thyroid doesn't give, etc. There tends to be a different pattern of symptoms that you see. Keep in mind also that as part of Lyme, you can have low thyroid, all right? And the reason that can happen is these increased cytokines that you get interfere with a part of the brain called the hypothalamus pituitary that's supposed to regulate your thyroid, regulate your adrenal glands, regulate your ovaries, all right? And so you can develop these symptoms of low thyroid that are part of the Lyme syndrome as well, too, all right? I hope that gives you some clues there. Yeah, anyhow, all right. Thanks, Sue, for that question. Hello, Tracy. Let's see. What is the cause of electrical type shocks that shoot up or down both legs, predominantly the left? So that symptom of shocks usually is due to involvement of your nerves by Lyme or possibly Bartonella, or maybe even from having some pressure on the nerves in the back from a slip disc, for instance, okay? But it's a neurologic symptom. So other symptoms that indicate that you have neurologic injury are numbness. Other qualities of pain besides this shooting can be zaps. Sometimes have people describe brain zaps that they get. You can have pain that is sharp, shooting, burning, tingling. Those tend to be the kind of lancing, those electrical. Those tend to be the kind of qualities of what I would call nerve pain. That's a nerve pain kind of quality that you're having. Okay. Thanks for that question, Tracy. Hi, Colleen. Let's see. Do Bartonella babesia symptoms cycle on and off erratically or in a pattern, or are they usually consistently there? So to answer your question, I want to let you know one other thing. Okay, so Lyme, the Lyme infection, not Bartonella, not babesia, but the Lyme infection, in some people does have a pattern where the symptoms worsen every 3 to 4 weeks, especially in women, and it seems to be related to your cycle, okay, your hormonal cycle. But it also occurs in men sometimes every 3 to 4 weeks too. And we postulate, or we wonder if it's due to the growth cycle, the way that Lyme grows, that there's more germ activity every 3 to 4 weeks, so you get more symptomatic, all right? Now, by comparison, Bartonella and babesia do not have a cycling pattern. That has not been my observation, and I've been doing this since 2004, so I haven't seen that as a pattern that suggests Bartonella or babesia to me. The pattern that does suggest infection to me, but Lyme infection, is a pattern of worsening every 3 to 4 weeks. And sometimes you'll see that come on actually as you start antibiotics, and I think it's because you get greater killing during those time periods. All right. Thanks for that question, Colleen. Hello, Eric. Let's see. My wife is using the glutathione 200 milligrams twice a day nebulized as per your book. Right after each treatment, she has a slight loose cough with clear sputum, which clears. Do you know what might be causing this? Is clearing something from her lungs? Thanks for all you do. So everyone, what Eric is describing is a way that you can use glutathione, all right? And so glutathione is a very strong antioxidant, reparative, fixes everything antioxidant that's made in every one of our cells. All right, so repairs damage from the inside. The other thing is it's made in large quantities in the liver, so it can help with detox. As a strong antioxidant, it's useful to take if you're having a lot of Herx problems because it removes toxins. It helps the liver remove toxins, so they're not triggering cytokines. But also as an antioxidant, it sends signals into it lowers oxidizing agents, and lowering oxidizing agents decreases the signals going to white blood cells telling them to make cytokines, all right? Because a Herxheimer reaction is due to the immune system reacting to all the dead bug parts and toxins and making more cytokines. So glutathione can help with liver detox. It can help with Herxheimer reactions. It can repair injury like liver inflammation or even nerve damage that you might get as part of Lyme, all right? I use it as part of nerve repair to help with detox. I use it also to help with your energy factories called your mitochondria. It can help them work better too, all right? Now, in terms of glutathione, there's different ways you can raise it. One way you can raise it is to use something called N-acetylcysteine, which is a building block, 500 milligrams 3 times a day. Or you can take oral glutathione, but you have to take a variety that is microscopically wrapped in fat, or we call that liposomal glutathione, because if you don't take it in a way that's wrapped in fat, it may not get absorbed well, right? So there's 2 products I like for that. One is called Trifortify Orange. Another one is called Trifortify Watermelon. Yes, Research Nutritionals has come out with a new form called Trifortify Watermelon, right? And we carry both of those at our store, by the way, too. But anyhow, if you were to do those, you want to do 5 milliliters once or twice a day, all right? The strongest way to get glutathione in to make sure that you get it absorbed is to do an intravenous administration. But something that comes very close to that, that's almost as strong, is to do breathing treatments of it. And that's what Eric is talking about. All right. So when you do breathing treatments, you want to, it's a liquid that you put in, you use a machine called a nebulizer machine to get into your lungs. All right. So Eric, one of the problems with nebulized glutathione is glutathione can be an irritating agent to the lung. And the lungs, in responding to that, will make mucus to protect itself. All right. Now, often I will even use it at 400 milligrams. So 200 milligrams twice a day is one way to do it. The strongest way to do it is actually 400 milligrams. If one thing you could try to decrease the irritating nature of this to the lungs is to dilute it in half. So depending on how you've had this done, if you would add about 2 more milliliters of water, I would use probably sterilized water or some kind of filtered water, that is. But add it in addition to the glutathione to the nebulizer liquid chamber. Add 2 more milliliters of sterile water, or it doesn't have to be sterile water, but filtered water, and that may take care of it. So if it's more dilute, it may make it less irritating to the lung. Okay, so basically the lungs are reacting to protect themselves from something that they're finding to be irritating. Okay, all right. And there's no long-term harm from it, though. I want to be clear about that. All right. Thanks for that question, Eric. Hello, Deborah. Hi, Dr. Ross. Last June, I started taking Houtunia, Sida acuta for Bartonella, Banderol and Cemento for Lyme as I quit antibiotics. My digestion is not normal. I'm trying to heal my gut. Can these antimicrobials cause damage to the gut or prevent healing? I have treated yeast when I think it is present. That's a good question. So Deborah and everyone, actually. So, the thing that gives the most damage to your gut lining or can alter the gut lining is to be on prescription antibiotics, all right? So prescription antibiotics, the way that they can interfere with your gut function is that they knock down good bacteria. They kill good bacteria that line your intestines, and that can create some problems. Now, herbal antibiotics, which is your Sida acuta, your Houtunia, your Banderol, and your Cemento, those are herbal antibiotics, but they're still antibiotics, all right? They can also knock down the good bacteria. I don't think it's as great of a problem, and I tend to see less of a problem of them doing it, but they can. I think I've read that one of my colleagues, Buhner, does not think that they do that as much, but my experience says they can. I even get people that have yeast problems on the Banderol Cemento, for instance. Okay, so the problem is that they probably are knocking down that good bacteria. Your solution is just make sure you're taking good probiotics. Now, keep in mind that most probiotics that are out there are garbage. Actually, they're not good. In fact, most supplements sold in supplement stores that are not like a physician grade kind of supplement are garbage. There's been good studies where people go in. New York State actually went in recently, I guess last year I think it was, and pulled a bunch of products off the shelves and looked to see the products that they say, the ingredients they say are in it. Are they in it? And the answer is no, even though these are certified products. All right. So your supplements are only as good as the place you get them from and whether there are high quality supplement brands. All right. What's a high quality supplement brand? I'll show you in a minute, all right? Because I've kind of taken the guesswork out of it for you, but most of the stuff out there is garbage. So to heal your gut, Deborah, make sure you're on good quality probiotics, all right? So you want to use a brand that has strains of something called Bifidobacterium and Lactobacillus that has strains that have been proven to repopulate the intestine. That's the problem, is most of the probiotics out there are not using strains that repopulate. What I like to use is a product called HMF Forte that has science that says, it uses strains that repopulate, all right? And you might want to be taking upwards of about 50 to 100 billion cultures one time a day. Another alternative to try to help heal your gut is to also take something called soil-based probiotics. And soil-based probiotics are literally bacteria from the ground, okay? Now, why does that make sense? Well, if you look at what has happened in our intestinal tract as humans over the last 100, 200 years, the bacteria makeup of our intestines has changed significantly. It used to be very similar to what came out of the ground, all right? But it isn't that way anymore. And one of the reasons it's not that way anymore is that basically our food no longer is, we don't step outside our door and pull our beets out of the ground and eat them after only washing them off, all right? So we don't have soil residue that gets to us anymore. But those bacteria do a better job at times of repopulating the intestines and also regulating the immune system, all right? All right, something else you might want to consider doing, Deborah, for GI health is to maintain and help the slime mucus lining layer of your gut, all right? And to do that, having vitamin A, 10,000 international units a day, one time a day, and vitamin D, about 5,000 international units one time a day too, can be helpful for that, all right? So, if you're going to be on your herbal antibiotics, just be aware that, yeah, they can cause disruption. It's just not as great of a chance. But if you're still having problems, make sure you're on a high quality probiotic, okay? And you might consider vitamin A and vitamin D. Now, a note about vitamin A. Women that are of childbearing age, if you're going to have a baby, should not do high dose vitamin A. But 10,000 international units a day is a safe dose of vitamin A. There's no problem in using that, okay? Even if you are of a pregnancy, of an age that you could get pregnant, all right? Okay, so thanks for that question. I'm going to do a quick screen share here. I want to show everyone something. All right, so, okay. So this is, I'm going to take you over here. This is my supplement store, Marty Ross MD Supplements. It's at treatlyme.com. I'm just circling it up there for you. If you're looking to see what kind of brands I recommend and products, if you're looking to see what is a high quality brand that has brands that have the greatest chance of having the active ingredients and not having artificial fillers in them that could hurt you, these are the ones I have selected. Okay, you can find them in my store. You could find the manufacturers I recommend just by going ahead and hitting supplements, looking down the by manufacturer list. These are what I, in my opinion, have found to be the product lines that I use, and I choose them because they have a great chance of having good active ingredients, and they have not put in artificial fillers that tend to be hurtful to people with Lyme, okay? That's why I choose these products, all right? So when I talk tonight about taking something and you're wondering, what does Marty Ross use? Well, this is my supplement store. This is where my patients get their supplements, and actually anyone can buy from us, all right? But if you're looking for what the supplement products are that I recommend I use, they're right down here on this list, okay? All right, let me go back here again. All right. Thank you for that question, Deborah. Good luck to you. All right. Let's see here. Hello, Tracy. Let's see. There was also a recent numbness like pins and needles on the entire right side of my head and around the right eye to exactly the right half side of the nose. Why is this happening as it relates to Lyme? So Lyme can cause nerve injury, and so it could be giving you some nerve injury giving that, okay? The other thing you ought to do, at least somewhere along the line, somebody should have measured or looked at a kidney liver test, which would give us information about whether you have adequate what is known as electrolytes, so sodium and potassium, to help your nerves run correctly, all right? And a blood count, to make sure the blood count we can look at, and we can look at the size of the red blood cells, and if they're too big, that can indicate a folate or a vitamin B12 problem, all right? So somebody should have looked to make sure you don't have something else contributing to your neuropathy, but it could be all related to Lyme, all right? Well, actually, Bartonella is a possibility as well, too. If you're wondering if you have Bartonella, I guess I kind of threw that one there at the end. So Bartonella, as many of you know from listening to my webinars, and as many of you know if you've been treated for Lyme for some time, Bartonella is hard to test for. And so it's a bacteria that you get from a tick bite, usually transmitted around the same time, if you have it, that you got your Lyme. all right? And so it's a co-infection. The testing for it is not great. We estimate that there are about 30 different strains. We can only really test well for 2 strains. Even Galaxy Labs, which is the lab that's one of the preeminent Bartonella labs, still only tests for 2 strains of Bartonella. It's not testing for all of the strains, okay? And so for that reason, I usually don't advocate testing for BART. I advocate treating based on whether you have enough symptoms that say Bartonella is there, okay? So symptoms that can suggest Bartonella include pain on the balls of the feet, anxiety, restless leg syndrome, which is a feeling of things crawling on your legs, and you got to move them around frequently because of that. Burning on urination and urge to pee frequently sometimes can be part of it. Neurologic hypersensitivities like sound, touch, or light sensitivity. Some people with Bartonella will have seizures. Sometimes they'll have problems with a feeling of internal vibrating or buzzing. Sometimes can be part of it. People with Bartonella sometimes get a rash that looks like stretch marks as well too, okay? And then cognitive issues can indicate Bartonella. So when I'm trying to decide if somebody has Bartonella, I pay attention more to the possibility of having, and if they have enough symptoms that suggest it, I want to treat for Bartonella, okay? That tends to be how I go about doing it, all right? So if you're wondering, if you want to look later to see more about this, let me just show you, do a quick screen share here again. All right, so I'm going to go over here. This is the Treat Lyme book, all right? And as many of you know, this is the resource that I put together with all the information I'm talking about with you tonight. You probably can find it here in the Treat Lyme book, all right? So the major part of this site is the Treat Lyme book, the information about Lyme. And where you're going to find it is in the Chapters tab, or you can search for information you need, all right? If you're trying to decide if you want to subscribe to the Treat Lyme book, you could try out the free articles that I have. There's about 4 of them here. Many of you know this is the tab you clicked on to sign up for my Lyme webinars, all right? Okay, but if you're trying to figure out if you have a diagnosis of Lyme, or if you have Bartonella, or if you have Babesia, all right, what you want to do is look in the chapter that says how to diagnose, all right? So you'll find that in my Lyme Disease 101 section, how to diagnose. And then you'd look under here, right? So if you want to see if you have mold or Lyme toxins, take a look here. If you want to see if you have too many yeast living in your intestines, take a look at my article on that, all right? If you want to know how to diagnose Babesia, if you might have it, even if you have negative testing, take a look at that article. And if you want to know if you have Bartonella, take a look at my article that says it could be Bartonella or Babesia, the symptoms and signs, okay? All right, let me go back here. So basically about anything you might want to know about Lyme, I probably have written an article about it. There's some updates that I need to make, and I've been dragging my feet here because I've had some other things going on that I've had to give us some attention to, but there will eventually be an article that I will put up about persister Lymes and persister Lyme, and also the treatments that you might use for that, okay? But basically, the book is 99% up to date, okay? And anything that's written there is relevant for you. So take a look there if you have information, you want to know how to treat Lyme, you want to know how to diagnose something, you want to know how to correct a problem that develops as part of Lyme treatment, take a look in the Treat Lyme book, okay? All right. So Tracy, thank you for that question. Good luck to you. Hello, Sheila. Hold on here just a minute. All right. So Sheila asked, are there any recommendations for inflammation and pain if the curcumin, or for brain inflammation and pain if the curcumin is not enough? All right. So the brain inflammation and pain can be caused by cytokines, all right, as many of you know. And so one of my favorite things to lower cytokines is curcumin. Curcumin is a component of turmeric. Turmeric is that Indian seasoning that gives Indian food its yellow coloring, okay? And so it can be useful, but it's not going to work for everyone. Make sure, first of all, Sheila, that you have maximized the dose, that you've taken as much as you possibly can. And what I like to do with curcumin is to take 1,000 milligrams 3 times a day, okay? Secondly, sometimes that brain pain can be caused by can be caused by toxin buildup. And so I would go ahead and add in the glutathione that I mentioned earlier tonight, 5 milliliters one time a day. And the product I like for that is the Tri-Fortify Orange, which is orange or Tri-Fortify watermelon, which is a liposomal, microscopically wrapped fat form that increases the chances of glutathione getting absorbed. Okay, that can help too. Something else that you might try is a strong antioxidant called Fiber Boost. It is a brown seaweed, actually, and it can do a good job of lowering cytokines as well too. Other things that can help with pain is to change the neurologic transmission of pain. And the herb that I like to do that is something called L-theanine. So theanine is a component of green tea, and it is converted in the head and in the brain into a chemical called GABA. And if you get, and so our brain is, our nerves in our head are full of a type of receptor called a GABA receptor, all right? Or they're called GABA benzodiazepine receptors. Many of you know Valium, for instance, is a benzodiazepine, all right? But if you raise GABA in the brain, it helps control pain, including head pain. So L-theanine is a 100 milligram pill. You can take anywhere from 2 to 6 pills at nighttime, because I also use it for sleep. And then you can take up to 600 milligrams throughout the day, or you could use 1,200 milligrams in the day plus an additional, 1,200 milligrams total in a 24-hour period. I will use it for sleep up to 600 milligrams a night, but if you're not using it all at nighttime, you could distribute so that you take 1,200 milligrams throughout the day as 400 milligrams 3 times a day of the L-theanine, okay? I hope I didn't get you too confused there with that dosing issues, all right? But again, the L-theanine is converted into a chemical called GABA that can help with pain too, all right? Then finally, make sure you're treating your infections that ultimately are leading to that pain. So you want to make sure that you're doing a good treatment of Babesia if it's there, Bartonella, and Lyme if it's there. Keep in mind that a hallmark symptom of Babesia can be migraines and frontal headaches, all right? So if you're happening to have a lot of front of the head headaches or migraines, take a look at how to diagnose Babesia, because you want to make sure it's not Babesia contributing to this too, okay? The other thing you might want to consider if you have a lot of headaches and nothing is helping is whether you have a mold or Lyme toxicity issue. And I just showed you that chapter that I just showed you about how to diagnose. Take a look there. There's a whole article I have in there about how to diagnose mold or Lyme toxicity issues that can be contributed to that kind of pain as well too. Okay? All right. Good luck to you, Sheila. Thank you for that question. Hello, Linda. Let's see. Hi, Dr. Ross. I've been pulsing nutraceuticals 3 days off and 4 on for 7 months. I've had great improvement. Can I increase the time off, go do a monthly off, or quit the meds completely? What are the benefits, risk of each? Will you explain cervical sympathetic ganglia and the ART and FSM treatment? I am not familiar with the FSM treatment, and I'm not sure what you mean by the ART. There's different ART. ART stands for something that I'm familiar with called autonomic response testing, which is a form of kinesiology to figure out if certain things that you're taking will work for you. But I'm not familiar with what an FSM treatment is. I'm sorry, Linda, I just don't recognize that. In terms of pulsing the antibiotics, there's different ways you can pulse. I mean, sometimes what I will do with my patients is I will have them actually take, and there's actually an article I wrote about this. In fact, I think it's about 2 months old now, 1 month or 2 months old. It's on pulsing the antibiotics, okay? So there's what I call short pulsing and long pulsing, all right? And they both do something different. So short pulsing means what do you do in a week? So like you're taking 4 days on, 3 days off, all right? And so that kind of pulsing has some foundation based in some Petri dish research. And what that shows us is that Lyme has the ability, spirochete Lyme and cyst Lyme, those 2 forms of the Lyme germ, have the ability to turn into something called a persister cell. And that if the germ is exposed to antibiotics, herbal or prescription, for a period of time, Some, about 20% of the germ forms according to one petri dish experiment. Okay, these are petri dishes. It doesn't mean for sure that's what happens in humans, but we can get some guidance from these petri dish experiments. According to this one petri dish experiment that was published out of Northeastern University, probably about a year and a half ago now, I think, Northeastern University in Boston, it was shown that when Lyme is exposed to antibiotics for a prolonged period of time, about 20% will turn into a persister cell. And what a persister is a form of a spirochete or a cyst that slows its metabolism way, way down to the point that it starts ignoring the antibiotics, okay? And so what they showed on that experiment is that if they stopped the antibiotics, that after about 24 hours, the germ would wake up and start to respond to the antibiotics again, all right? Now, these were tightly controlled experiments where they literally had petri dishes and they washed the antibiotic off, all right? So when they washed it off, that germ was no longer being exposed. Keep in mind, in us as humans, if we stop something, that doesn't mean that it automatically gets out of us right away, and the germ may still be exposed to that for a while. So what I usually advocate is come off for about 3 days. I think that's going to be enough to kick your germ back into a growth cycle, okay? So that's what you would do. I call that a short pulse, all right? Then there is something called what I call a long pulse, which is to come off of your antibiotics for 1 month or even 2 months. And I often do it for 2 months, all right? And I do that also to deal with the same issue of those persister cells, which is you can get the 20% that have gone into a persister form to come back into a growth phase, all right? But I also think what can happen, I don't have any science behind this, okay, but keep in mind that the Lyme germ has 3 forms, right? So there's the spirochete, which is the thing that looks like a corkscrew. You see that on the internet. There's a form of the germ that lives inside of your cells. We call that intracellular Lyme. And then there's also a microscopic cyst form of the germ, all right? All right, now, when you treat those long enough, what happens is even if you treat for all 3 forms, the more treatment-resistant forms are intracellular Lyme and probably cyst Lyme, all right? And probably more cyst Lyme, actually. So if you treat for a long time, what happens is those germs get under stress more and more over time, even if you try to do things to limit them, may turn into the cyst form, which is harder to treat, all right? All right, the other thing that can happen when you treat with antibiotics for a while is that the germs also under stress will convert more into biofilm communities, all right? So biofilm is a slime layer that has a protein skeleton that holds it together that can cover the Lyme germs. And it's harder to treat Lyme in biofilm communities, okay? So after you've used antibiotics for a while, more and more of the germs may have converted into cyst form and into biofilm communities, as well as become persister cells. So when you do the long pulse, which is 1 month on, 1 month off, or 2 months on, 2 months off, what happens is during that period that you're off, those germs will come back out of the cyst form, will come back out of biofilm community, will come back out of persister cells, so that when you then restart the antibiotics, you get a bigger kill, okay? Now, the person that came up with this idea to do a 2 month on, 2 month off, or something near a 2 month on, 2 month off, was a guy named Burrascano. Many of you may know of Dr. Burrascano. Dr. Burrascano was one of the pioneers of Lyme treatment in this country. He's not treating anymore. I think it's been about 5 or 6 years since he treated. But before he stopped treating, he claims that he cured his Lyme by doing this regimen of letting himself get really sick that would take about 2 months being off antibiotics, and then going back on for about 2 months. Then he would stop, and he'd get sick again, get really sick to the point he couldn't stand it. Then he'd go back on, all right? And that worked out to roughly about a 2 month on, 2 month off. And he had to do that 4 times, 4 cycles of being on for 2 months, being off for 2 months, okay? And so that's one cycle. Do that 4 times. And he claims he cured his Lyme, all right? Now, I've tried that in a number of people. I don't think I've quite had that kind of success, and I don't think it works in everyone. But there are groups of people that if you do this long pulse, it can get them better, maybe cure them. I don't think I've ever cured anyone with it, but I've got some people with substantial results, okay? Now, sometimes what I will do with my treatments to even make this more confusing is when a person is on the 2 month on part or the 1 month on part of their treatment, I will have them do a short pulse within that. So during the month they take it, or the 2 months, Each week they'll take their drugs 4 days on and be off for 3 days. All right. And then at the end of a month or at the end of 2 months, they stop for 1 to 2 months completely. All right. So I call that short pulsing and a long pulse. All right. If this is confusing, I've got a whole article that I've written about it. And actually, I'll try to show you it here in just a second that you can look at that. Okay. But anyhow, those are some ideas. All right. Now, why can you stop antibiotics and be okay? Right. Why can you stop for 2 months? Well, Lyme grows really, really slowly. And in fact, some estimates would suggest that it takes about 4 weeks to even 8 months for a germ to replicate. And what that means is when you stop, the germ, you are not going to suddenly be overwhelmed with this overwhelming volume of Lyme taking your body back over, okay? It takes a long time for Lyme to get active. Now, by comparison, if you are treating Bartonella or you are treating Babesia, you do not want to stop those in the middle of a treatment. They come back fast. And Bartonella, for instance, has a replication cycle of every 24 hours, all right? So the germ regrows itself every 24 hours. So you can't stop BART treatment in the middle of a BART treatment or the BART antibiotics in the middle of a BART treatment, nor can you do that with Babesia. It's not a good idea. You'll go back to the beginning, okay? But in Lyme, it's a good thing to do. So Linda, I hope that gives you some ideas. Let me go ahead and do a quick screen share here. I'm going to try to see if I can find my article on pulsing. All right, let's see here. Just going to do a quick search for it here. Yeah, here's the article. It's called "How to Pulse Lyme Antibiotics." Okay. Now, in this article, you will see that I describe the short pulse and the long pulse. Okay. All right. So there you go. All right. Let me go back here. All right, Linda. Good luck to you. Thank you for that question. Hello, Charlene. Let's see. Hi, Dr. Ross. What do you think about the nanosciences test to determine if Lyme is active or not? Thanks again for the time you're willing to give. I think what you mean is the nanotrap test. So that test looks to see, do you have Lyme, parts of Lyme? You know, the trouble is with the test, it's a newer test. I think it may be a useful test in determining if you have acute Lyme. I don't think it is going to prove to be a useful test to determine if Lyme is active or not active in you, all right? And I don't think it will work as a "are we done with Lyme" test, all right? But I think in an acute setting, the nanotrap test may be useful in figuring out if Lyme is there. It will show that Lyme is active in you before you develop antibodies, actually, okay? That would be how I use that test at this point, okay? All right. Thanks, Charlene. Hello, Danny. Let's see. Is there any connection between non-epileptic seizures and Lyme or Lyme-like disease? All right. So it's a good question. So there are, I think what you're describing by well, actually, I'm not sure what you mean, but let me try to be clear about this. So non-epileptic seizures could mean having seizures that appear to be seizures. You're shaking and you're jerking. But when you get hooked up to an EEG, which is the way of looking to see, are you having seizures, which uses a bunch of wires attached to your brain, and we measure electrical activity to see if you're having electrical activity suggesting seizures. Often in Lyme and in Bartonella, people that have what just seems like the worst seizures in the world, when you hook up the EEG, nothing gets picked up, okay? I think that's what you mean by non-epileptic seizures, okay? If not, I'm not quite sure what you mean. But if that's what you mean, it's very common in Lyme to have that. And I'm just amazed that people have these kind of seizure episodes, and I call them seizure-like activity, actually, because nothing will show up on EEG. And the problem is the neurologists, when they look at you, want to say it's all in your head then, okay? Because they will only focus on that EEG, and if it doesn't show up on an EEG, it can't be there, and you got to be making it up, all right? Now, they're wrong, because it's a very common pattern that I see in Lyme when people have seizures that it's not going to be detected on the EEG Why that is, I don't know. But it is a phenomenon that I have seen. All right. So I have seen it in Lyme. I have seen it in Bartonella as well, too. Okay. All right, Danny. I hope that answers your question. All right. Hello, Jenny. Let's see. Thank you for all your help and wisdom. You're welcome. You told me that I have symptoms of BART in one of the webinars, and I agree with you. I would like to take Houtunia and Sida acuta for the BART. Can I take Cemento and Banderol at the same time, or are they incompatible herbs? Thanks. All right. So to answer your question, Jenny, yes, you can take all of those herbs at the same time. In fact, you can take them all literally at the same time. You can take them together if you want to. Okay. So now I just need to give a quick overview for everyone else. All right. So what many of you may know is that in treating Lyme, we have to make sure we treat all three forms of your germ. Okay. And that is because there's a spirochete, which looks like a corkscrew. There's a form of Lyme that lives inside of your cells. And then there's a microscopic cyst form of the germ. My favorite two herbal products to manage Lyme are Banderol and Cemento. All right. If you read in the Treat Lyme book, I can't use products by name because I'm forbid by doing so by the Food and Drug Administration. If you read in the Treat Lyme book, you're going to see that I refer to cat's claw, which is Cemento. Okay. And something called Atoba bark extract, which is the Banderol. All right. Now, those two herbs together, based on my experience, I think they work 85 to 90% of the time. They can be as effective. They are as effective as prescription antibiotic combinations that also will work about 85 to 90% of the time. Okay. So those are good herbs. All right. And then when it comes to treating for Bartonella, the best herbal combination I have found is to do this combination of Houtunia and Sida acuta. All right. And I got the idea on using those from a guy named Buhner. Many of you may be familiar with Buhner, as in Buhner herbs. All right. Now, Buhner recommends some other things for managing Bartonella that I don't think you need to do. I think this is the key component that works, but it works 70 to 75% of the time. Probably the stronger way that we have to manage Bartonella is actually prescription options. They're going to work 80 to 85% of the time. Okay. So if you're looking at what your options are to treat Lyme and Bartonella prescriptively and herbally, let me show you the two articles that you'll take a look at. I think one of them is a free article. It's the one on managing Lyme. Let's see here. All right. So in terms of the article on how to treat Lyme with antibiotics, here's my Lyme disease antibiotic guide. Okay, take a look at that. And in there, I even have information about the about the Atoba bark extract and the cat's claw. Okay, all right. Then, if you're looking for information about how to treat Bartonella or Babesia, for instance, take a look in the infection treatment plans section. Okay, chapter that is. And you'll see that I've got an article called Kills Babesia, which lays out both prescription and herbal options. My article on Bartonella is called Kills Bartonella, Brief Guide. Again, prescription and herbal options. And then, again, you'll find anything here, how to kill yeast, how to kill parasites. And basically, I have an article here about how to kill about anything, okay? And I try to lay out, as many of you know, I'm an integrative functional medicine doctor, and I try to lay out both natural as well as prescription options. And I give you the odds in both of those articles. What chance is this going to work? What chance is this going to work? Okay. So I try to give you the options. All right. So good luck to you, Jenny. And thank you for asking that question. All right. Hello, Brenda. Thank you, Dr. Russ, for these webinars. I have learned so much from you. Thanks, Brenda. I appreciate those comments. So just so you all know, I don't really read these things before I put them up, okay? If I happen to see a name in my message board over here that looks like they might have posted a question twice, I'll start to read through the question initially, but just make sure it's not the same person, same question again. But so anyhow, thank you, Brenda. I appreciate that. All right. Hello, Sarah. Let's see. Hello, Dr. Ross. What if almost 3 months of glucosamine sulfate, 15 milligrams a day, has not helped my Lyme arthritis, hip, and knee pain while walking? What else can I try? Thanks for your help. Hmm. So anyhow, I may not have the greatest answer here for you, Sarah, but let me kick some things around, okay? And I just want to explain a few things for everyone first. All right. So what Sarah's using for her pain in her joints is glucosamine sulfate. All right. Glucosamine sulfate is a chemical building block or an herbal or a supplement building block for cartilage. It's what the body uses to create cartilage. All right. And wherever two bones come together in the body, so in a joint like your finger joints here, okay, or a hip joint or a knee joint, the surfaces of those bones in the joint are covered by cartilage, and cartilage is softer than the bone it covers. Excuse me, the bone it covers. So one of its functions is it acts as a shock absorber. It makes it so that when bones hit each other, they bounce off. They don't injure the underlying bone. All right. The other function of cartilage is that it's smooth, so it allows the bones to glide over each other easily in that joint too. All right. Now, the problem is that the cartilage is less softer than the bone, and eventually it can wear down. And if it does wear down, you get bone rubbing on bone, which leads to chronic inflammation in the bone, which leads to pain. All right. Now, in Lyme, sometimes, so the Lyme infection and trying to escape from the immune system tries to burrow itself into tissues far away from blood flow. All right. And one of the things it does in the joints is it can release, it makes enzymes that can literally break down the cartilage. So sometimes I will see a greater chance of getting joint pain in somebody with Lyme because they literally have worn down their cartilage in the joints. Okay. And so, what I will use in situations like that to rebuild the cartilage is glucosamine sulfate. The thing about glucosamine sulfate is it tends to work about 80% of the time, but it doesn't work in everyone. All right. And so, Sarah, if your problem is from cartilage wearing down, yeah, by 3 months it should have worked. So I would just go ahead and stop it. All right. Now, you might consider trying something to help repair so glucosamine in the joints has to be held together by a sulfur bound binding substance called MSM. And you might try MSM 500 milligrams twice a day as a means of enhancing the cartilage in the joints, okay? But the other thing I would consider is have you adequately got your germs under control? Because also, if you have germs in the joints still leading to inflammation, you're going to have pain from that too. So, and I can't figure that out with this brief question, but I would say make sure you're getting your Lyme under control. Okay. The other thing you could consider trying for joint pain is a prescription medicine called Plaquenil. Plaquenil is a medicine that was originally designed to treat malaria. It's a quinine derivative, but the rheumatologist quickly found out that it's great for inflammation in joints. All right. And so Plaquenil would be prescription medicine, 200 milligrams twice a day. Sarah, other antibiotics that it can have anti-inflammatory properties would be your tetracyclines like a doxycycline or minocycline. Sometimes Biaxin can have good anti-inflammatory properties too, so you might look at doing that too. And then finally, consider acupuncture. Acupuncture can do a great job for ongoing joint pains. If you happen to be here in the Seattle area, the guy that I recommend is a guy named Randy Clare. That's Clere. He's a marvelous Japanese style acupuncturist that has done a great job for a lot of my patients here. He is in north of Seattle, a place called Shoreline, but Randy Clare would be a good option if you're in the Seattle area, Washington State. But acupuncture can be useful for these kind of situations as well, too. All right. And then finally, make sure you're on the good herbal anti-inflammatories, which would be curcumin, 500 milligrams. You could even do 1,000 milligrams 3 times a day. If that doesn't seem to be doing well enough, look again at the Fibro Boost, also known as Eclonia cava. That's Eklonia. I'm sorry, Ecklonia, Eclonia, and then second word cava, Cava, also known as the product called Fibro Boost, which is brown seaweed extract. And I would do 2 pills 2 times a day of that. Okay. Those are just some ideas to kick around. Okay. All right, Sarah. Good luck to you. Excuse me just a minute here, CJ. Hi, CJ. Hi, Dr. Ross. My Lyme literate medical doctor feels I don't have Babesia in spite of having many symptoms because the test was negative and my red blood cell hemoglobin and hematocrit are high. Could you please comment, please? I'm being treated for Lyme, Bartonella, EBV, and HHV6. So I disagree. You can have a normal hematocrit, a normal hemoglobin, normal white blood cell counts, and still have Babesia. And the testing being negative does not exclude it at all because there are multiple strains that are not picked up by the testing. So I go by symptoms, and as you know, and I showed you the article earlier tonight. So if you have a number of those symptoms, I would suggest treating for it. Okay, that's just how I operate. Okay, good luck to you, CJ. CJ, if you missed it earlier, there's a chapter called in the chapters tab in the Treat Lyme book. Look on the How to Diagnose tab. Look up the how to diagnose Babesia. You can even print that out and bring it to your doc and see maybe that will influence your doc a little bit better. Okay, all right. Good luck to you. Hello, Brenda. Let's see. What is the most aggressive treatment that you have done for chronic Lyme patients? How much success have you had with the dapsone treatment? Well, those are big questions. All right, let's start with dapsone. Dapsone is too early for me to say if it's working. My observation is that it's a hard drug to do. I know many of you may have seen there's some video clips now or YouTube videos of Dr. Horowitz talking. Horowitz is the physician out in White Plains, New York that is the guy that did the study about dapsone, is promoting its usage. But I think he way downplays how hard and difficult this drug can be from a side effect standpoint and from a Herxheimer standpoint. I've got a number of patients that I am starting it on. I'm just trying to see. It's too early for me to say whether I find it to be as beneficial as he does. He did a study involving 100 patients. Many of you may be familiar with that study, in which he showed that there can be benefit, especially in people that have Lyme and Babesia. Now, that's his patients, 100 patients. That does not mean it's going to be something that's going to work universally in other people throughout the country. We just don't know yet, all right? I'll be glad to let you know probably about another 6 months. I think I have maybe about 10 or 15 people I'm doing it on right now. And so he's using what makes dapsone difficult is two things. Number one, it can give you significant Herxheimer reactions, and so you have to start very low and slow. Okay. Secondly, it has a side effect profile. In other words, the side effects it causes look almost identical to a Herxheimer reaction. Okay, so people can get more fatigue, they can get more body pain as a side effect of dapsone. All right, so it can be kind of difficult to do, but I am trying it out. It's just too early for me to say if I'm going to see the kind of success that that Dr. Horowitz said that he had in his practice. Okay, I am though working with other ways of treating for persister Lyme. All right, so the reason that Dr. Horowitz came up with the idea of using dapsone is this new idea that's starting to float around, that's getting some scientific evidence that says that maybe Lyme is hard to recover from is because Lyme has the ability to develop these things called persister cells. I talked about that earlier tonight, right? So that Lyme has the ability, when it's been exposed to antibiotics for a while, to just basically turn its metabolism way down, and it stops responding to the antibiotics. Now, it's too early for us to say what's the best way to treat that. There is the Horowitz study that says, yep, he did help some people. It was only 100 people, though. It's hard to base medicine based on studies of 100 people, but maybe it's going to be something that's going to help a lot of people. There's also being Petri dish experiments going on now. Dr. Zhang, who is out of Johns Hopkins, has been doing a lot of work on Petri dish experiments, looking to see if there are drug combinations that might work well. And one of the ones he proposes that, and I'm trying this on patients right now too, it's just too early again to see if this is going to be helpful, is to do a combination of cefuroxime combined with doxycycline combined with a sulfa antibiotic called Bactrim. On Petri dish, that looks good. I'm starting a number of people. I'm having some improvements in those patients, but it's too early for me to report to you as well, too. So at this point, I am looking at treatments for persister Lyme. It's just a bit early for me to let you know. Probably a good 6 to 9 months from now, I'll be able to give you better informed input on what I find to be working well. What's the most aggressive treatment? that's a hard thing to say. I mean, there's many ways that I treat Lyme that all of them can be considered to be aggressive. So I don't know that I can easily answer that question for you. Okay. All right. Thank you for that question, Brenda. Good luck to you. Hello, Emily. Let's see. I've been relapsing on oral antibiotics since November when I had a car accident. I tried stopping antibiotics and doing your yeast protocol, saw improvement, but still lots of BART and Babesia symptoms. Lyme doc says antibiotics aren't working for me after 3 years. What are your thoughts? So, Emily, probably the most thorough way that I can answer this would be if you and I would be glad to give you direct input, but I need a lot more information than you have here. I'll make some general comments, but I need a lot more information. Let me show you something and I'll come back and try to give you general comments. So the one thing that you might want to take a look at, and this is a way that I can help you and I can help other people too, is I have on my Treat Lyme book site, there's this online consult tab. Take a look here, read through the whole thing, including the how it works section and the disclaimer section, okay? But if you want, I could help you with one of these online consults. In it, I visit with you over the internet. I can see you and you can see me. I get to ask you a lot of questions, okay? And it gives me ability to kind of fine tune my recommendations to you, because right now I can just give you some general ones. The only downside of that one-to-one consult is I cannot prescribe because I don't get to examine you. My board won't let me do that. And the other thing is I can't order any tests, but I can give you my opinion, okay? And I can give you a good opinion, actually. I think it's a good opinion, at least. So anyhow, in terms of, so yes, when people relapse, one of the first things I consider is it can be too many yeast, all right? And you want to make sure that you actually got your yeast out. And so if you're still having significant symptoms of either sugar cravings, gassiness or bloating, acne, skin rashes, vaginal itching, vaginal discharge, if you're still having that, you may need to treat yeast longer. You may even need to consider changing from diflucan to something else, because sometimes yeast does get resistant to even the diflucan. Okay, so that's one thought. All right. Could it be BART and Babesia got reactivated from the trauma of your car accident? Yes. Does it mean that all antibiotic combinations will not work? No. So what I would want to do is talk with you more to see, is it look like BART? Does it look like Babesia? What combinations of antibiotics have you tried? What haven't you tried? What might you want to put together to kind of help bring you out of Babesia and BART if they're active? And I'd be glad to look at that with you as well too, okay? It could even be Lyme got reactivated. Maybe you need to go with a different combination on that. So I have a lot of questions to ask you so that I can give you the best answer, okay? All right, so consider doing one of those one-to-one consults. All right, good luck to you, Emily. Thank you for that question. Hello, John. Let's see. Hi, Dr. Ross. Thank you for all that you do. You're welcome. My Genova adrenal saliva test has 4 p.m. high cortisol, borderline high DHEA, and high DHEA cortisol ratio. What to do? I also have blood tests dating back 3 years that show a few IgM infections, a lot of IgG infections. Treatment? All right. So, to answer your question about IgM and IgG infections, I would need to see what kind of infections they are. But let me just make a few observations. So, IgM, everyone, is a family of antibodies called IgM, right? And then IgG is another family of antibodies called IgG. When we first get sick with infections, we develop IgM antibodies. And then eventually, at about 3 months or so, those go away, and we then develop IgG antibodies, all right? Now, Lyme is one of the rare infections where IgMs don't go away. In fact, about 80% of the time that somebody has Lyme, IgM antibodies will remain positive, right? But all other infections, IgMs will go away. So, John, if you have IgM antibodies against anything, that probably means an active infection, and you probably ought to be treated for those, all right? In terms of IgG antibodies, once you develop IgGs, they serve as the memory of the immune system. Once we make them, they remain, all right? And so it's difficult in looking at IgGs to tell if it is still in you and active or is it being controlled, all right? So for instance, there are common virus infections that happen even in healthy people, like the monovirus can happen in healthy people, something called cytomegalovirus, something called human herpes virus type 6, which is a respiratory virus. These are common in healthy people, right? So just finding an IgG does not necessarily mean it's a problem. Now, there are some people that postulate, some physicians that think that if you have really high IgG levels, that it means that that germ has gotten active. And there's one study that has been done that gives some benefit that says, yeah, that might be right. But there's only been one study done that shows that. So it's not always clear to me if IgGs are high, do you actually have active infection or not? Now, if you have very high IgG titers against these viruses, there is something I do to look at to get further evidence to see if it really is active viruses. And what I do is I like to do a test called a nagalase test. That's Nagalase. It's an enzyme that is made by viruses and can actually be made by cancer cells too, that if it's elevated, can indicate that you have active virus infections, all right? If you want to read more about that nagalase and where you can get the testing done, take a look at the article that I've written called How to Diagnose Viruses and How to Treat Viruses, okay? You'll find that in the treatment section, all right? But anyhow, so I might sometimes do a nagalase. There's a lab out in New Jersey that you have to order their kit to do that test called Health Diagnostics, I believe is the name of the lab. But that's how I would try to figure out if it's IgG. But again, or that you have active infection if you have IgG titers elevated against viruses, okay? Let's see here. In terms of your cortisol DHEA, you might consider to get, to help support your adrenals to work correctly, using an adrenal adaptogen, which is an herb that helps your adrenals function better. And the one that I like to use is something called ashwagandha. It's a 400 milligram pill. I would do 1 to 2 pills in the morning and 1 to 2 pills between 1 and 2. Those are some thoughts that I have for you, okay? Let me do a quick screenshot. I want to show you we can read more about this nagalase and what I do for viruses as well, too. All right, so I'm just going to do my search function here. So let's look up nagalase. All right, so you'll find information about nagalase in this How and When to Treat Chronic Viruses, a brief guide, okay? So I talk with you about even the difficulties of doing the IgG testing, okay? All right. All right, let me go back here. Okay, John, I hope that gives you some useful information. Good luck to you. Hello, Brittany. Let's see. Would you recommend I continue azithromycin 250 milligrams twice a day for 3 days on, 4 days off to help prevent Lyme transmission, although I have massive yeast overgrowth and leaky gut during pregnancy? So, so first of all, just a comment. I don't understand why my colleagues pulse dose azithromycin. All right, why they do this starting and stopping, because it makes no sense. And I have to tell you why it makes no sense. So azithromycin has a long elimination half-life. The time it takes to get half out of you is extremely long. In fact, I think, I've looked it up before, but it's going to take from the time, and what that means is once the drug is in you, it's not getting out of you quickly, all right? So if they're pulsing the antibiotics because they think they're going to have better killing of Lyme, guess what? The antibiotics stay in you during those days that you're off of it. And so therefore, the idea of using pulse to treat persister Lyme makes no sense, because for pulsing antibiotics to work for persister Lyme, you need to have a period where you're actually off of it, okay? So I just want to make that comment, all right? The other problem, though, is in pregnancy, I want to maintain high levels of my drug because we want to make sure that your baby is being bathed in the drug so that it doesn't get transmitted over to your baby, all right? So what would I do? I recommend staying on your antibiotic during pregnancy because the studies that are the pregnancy registry data that we have that was collected out of the East Coast in the 80s says that if you're on antibiotics during pregnancy, that transmission rate can go from 50% to 0%. All right. And I don't know that if you stop the antibiotics for some time, a prolonged period of time, you may run into trouble. Okay. I want to assure you, the days you're off antibiotics right now, you still have antibiotics in you because, again, this stuff takes a good week to get out of you or more based on its elimination half-life. Okay. All right. How do you get rid of your yeast? Well, one thing I would do is you can go ahead and be on nystatin during pregnancy. Nystatin is not absorbed at all out of the intestines. And when I use antibiotics during pregnancy for my female patients, I will also have them take nystatin at the same time to prevent yeast. All right. So nystatin is a 500,000 international unit pill, 2 pills 2 times a day. It can help treat yeast. It may not get all the way over it though. All right. And for a brief period of time, you can use diflucan during pregnancy, and you might even want to consider using diflucan for maybe a week or 2 weeks in addition to nystatin. Now, diflucan is systemically absorbed, but would have minimal risk to your baby, but I wouldn't want to do it too long. Nystatin, again, is not absorbed out of your from your intestines into the bloodstream, so therefore should be safe for your baby and safe for you as well too, okay? The other thing is make sure you're doing a good job of taking lots and lots of probiotics. You should be taking at least 100 billion, yep, that word is billion, live cultures of your probiotics one time a day. And make sure if you're doing probiotics, especially in pregnancy, that you're using a product proven to repopulate, all right? And that product that I have here is something called HMF Forte. There's another product out there that I would say meets that criterion. It's called HLC. Either way, either HLC by Pharmax or HMF Forte that I carry here. Make sure you're taking 100 billion cultures one time a day to repopulate your intestines with good bacteria, okay, to fight away that yeast, okay? All right. Good luck to you, Brittany. Hello, Michael. Let's say, hey, doc, have you used lion manes or yellow bracket mushrooms for the treatment of Lyme? No, I haven't, actually. So I don't have any good comments on that one for you. All right. Thanks for that question, Michael. Hello, Catherine. Let's see. What do you think of Alinea, which is, Catherine's written down the generic name, which is, I can never say this one correctly. I just call it Alinea. I guess the rest of it's a mouthful. I stumble on it all the time. Can it be used to treat Lyme, parasites, bacteria, mold, and viruses, etc.? Okay. So Alinea is a medicine that was designed to treat parasites. And the mechanism by which it works, it treats what are known as anaerobic bacteria and parasites that do not require oxygen, okay? And so we have good studies that show it kills parasites. In fact, I consider it to be very useful for treating parasites that you can't even identify what they are. So I use it if I want to use something that's a shotgun approach. I give you something that I'm pretty sure is going to treat most varieties of parasites. I'm going to use Alinea. And I like using it as 500 milligrams 2 times a day, all right? Can it treat Lyme? I think so, because I see some pretty good Herxheimer reactions on it when I use it, and I don't think somebody has parasites. The mechanism by which it works, it probably treats spirochete Lyme, probably treats cyst Lyme, but we have no studies that say that it does, okay? Now, would it treat mold or viruses? No, I don't think it is useful against those. And sometimes some of my colleagues will use it to treat for Babesia, but Babesia requires oxygen, so it's aerobic, and this is a anaerobic, a non-oxygen requiring antimicrobial that works on germs that don't require oxygen. So I don't think that Alinea is going to be helpful for Babesia. Okay, all right. Hope that answers your question. Good luck. Hello, Dawn. Let's see how to prevent flu and viruses when you have Lyme co-infections. All right, so I'll show you an article about what you can do. I'll show you the article here in a minute, okay? But anyhow, what I'll do, if I've got somebody that, to prevent viruses, especially if I've got somebody that's getting repeat viruses, I like to use an herb or a mushroom called reishi gano mushroom. It's Reishi and then gano, Gano, 400 milligrams 3 times a day. Now, I like using a product by a company called JHS Naturals. And the reason I like doing that is they do a hot water extraction that is free of a bunch of garbage like mold and stuff you might pick up if you used ground up mushrooms, okay? It's a good product. Reishi does a good job at turning on the antiviral part of your immune system, all right? And it can be used to prevent viral infections, all right? The other thing you might want to do at the first sign that you are going to get a virus, so that you got that sore throat coming on, you're starting to get stuffy in your nose. The first sign you have something that's viral going on, the other thing I like to do is to have my patients take something called thymus gland protein A. So thymus gland is an immune system organ that sits here in your chest. That's big when we're kids, not so big when we're adults. It makes this protein called thymus gland protein A. And what thymus gland protein A does is it acutely turns on the antiviral part of your immune system, okay? Just revs it up really fast. And so what you can do with ProBoost is you can do it comes so thymus gland protein A is sold as a product called ProBoost, and it comes in packets. And what you do on the first day that you find you might have something viral going on is you open up a whole packet, put it under your tongue, and you do that every 2 hours, 3 times. All right. So day 1, you take it 3 times every 2 hours. All right. Second day, you do that again, but you spread it out throughout the day. So you take it 3 times on that second day, but you spread it throughout the day. And generally, that can stop most things from escalating into becoming a full-on virus, okay? A full-on viral syndrome, all right? The other thing you can do that you can even do that's stronger at the first sign you're having a virus is to add in some olive leaf extract, which is an herb that kills viruses, 500 milligrams 3 times a day, okay? So I write about these things in an article that I have, and let me just show you that article. You're going to look under we'll look in the chapters, the infection treatment plans. Where are you? Oh, there it is, right there underneath my mouse. All right, take a look. There's an article that I've written called Keep This Cold and Flu Package on Hand for Fast Results. And in this article, I also talk about what to do to prevent viruses, including that information on the reishi gano mushrooms that I was just telling you about, okay? And then if you want to make sure you're taking a good quality product, it would be this one by JHS Natural Products called Reishi Gano. All right. This is a good clean mushroom formula that I use for my patients that have Lyme. Okay. All right. Let me go back here. All right. Thank you, Don, for that question. And good luck. Hello, Alicia. Let's see. Hi, Marty, and thank you for your time. You're welcome. I am beginning the testing process for Lyme disease in Melbourne, Australia. I have had strongyloides for 10 years, and in November, December, had 4 doses of ivermectin back-to-back to try and eradicate it. I am still unwell. We considered Lyme testing 5 years back when let's see here. I want to see if I can find the second part of your question there. There we go. When I started with symptoms, but finances held us back. We understand the difficulties associated with accuracy in testing. We are, however, not sure of which laboratory-specific test we should try first here in Australia, if any. My first blood test has gone to the Australian Rickettsial Reference Lab. Okay, so Alicia, let me just tell you one thing you might want to consider even on top of doing that testing, okay? So strongyloides, everyone, is a parasite, okay? And so you have evidence of one parasite infection. So I just want to let you know that means there's the possibility you picked up other parasites too. The ivermectin would treat the strongyloides and may pick up a handful of other types of parasites, but it is still possible, especially if you have a lot of GI symptoms, that you could have parasites in the intestines that the testing just isn't showing, okay? So often what I will do in these situations is I will have a person take the Alinea that somebody else just asked me about as a 500 milligram pill 2 times a day. And I'll do that 500 milligrams 2 times a day. And I'm just looking up the generic spelling of that for you. So it's Alinea 500 milligrams 2 times a day. And I would do that for 3 weeks. That's how I usually, that's my anti-parasite protocol. Okay. Bear with me here because in Australia, you're probably going to have the generic name of this. Bear with me here. I can't see. All right. So the generic name for Alinea is spelled Nitazoxanide. Okay. Nitazoxanide. All right. So Nitazoxanide. 500 milligrams 2 times a day is a wonderful universal antiparasite. Okay. All right. Then, in terms of using your resources wisely, all right, that's important. I would consider doing Lyme testing in Australia using 2 different labs. One is IGeneX Labs, which is here out of the States. And I would only do 2 tests from them. I would only get the Western blot test, which is test 188 and 189. Okay. Do not waste your money on all their different Lyme panels that they have. Just get the Western blot, test 188, test 189. Google IGeneX on the internet. You'll find their website. You can literally order up the lab test kit yourself, bring it to your doctor, check off box 188, 189, have them sign off on it so you can get it ordered, send it off to IGeneX. All right. Now, their Lyme test does pick up more North American varieties of Lyme, but there's a lot of cross-reactivity between Lyme across the world, whether it's European, Australian, or wherever it is, and the Lyme that we have here in North America. So I would do that, okay? All right. Then I would also consider getting a test kit from a lab in Germany called Armin Labs. That's ARMIN. And through Armin Labs, I would do the ELISpot test. That's ELLISPOT for Lyme. And you might consider doing it for Bartonella. No, I wouldn't bother. Just do the ELISpot test for Lyme. All right. All right. So the issue with the co-infection, the reason I'm telling you not to do co-infections, I think testing is just not good no matter where you are. You have to make a decision to treat for co-infections based on symptoms. But in terms of getting a Lyme diagnosis, the Western blot will pick it up about 80-85% of the time. The best Western blot laboratory, I think, in the world is IGeneX. I don't think other companies do it as good. All right. Now, I will let you know that, yes, Armin Labs does a Western blot, but I still think the better Western blot lab is IGeneX. All right. What Armin's doing with the ELISpot test, so what a Western blot does with any lab that does it is they're looking to see, do you have antibodies? Has your immune system made antibodies that attach to the Lyme germ? What an ELISpot test does is it looks to see, do a type of white blood cell that you have called T cells, do your T cells recognize Lyme when exposed to it? And if they do, it means that they have seen Lyme in you before, okay? And that test can find Lyme about 80-85% of the time too, all right? So I would consider doing both of those to increase your chances. But to save your resources, don't do all the co-infection testing. Don't do all the panels. Just test 188, 189 from IGeneX, and then the ELISpot test for Lyme only from Armin Labs, and that's ARMIN out of Germany. Okay, you can Google them and find them as well too. Okay, all right, and then consider doing the Alinea for potential intestinal parasites if you have any symptoms that are still intestinal symptoms as well. All right, okay. Good luck to you. Thank you for that question. All right, let's see. Where are we here time-wise? All right, let's see here. Hello, Marcelina. Let's see. Hi, Dr. Ross. Our 4-year-old daughter has a vexing combination of issues. She has the following: a CDC positive Lyme diagnosis, a positive SIBO breath test, a persistent fungal infection verified. And let's see if I can find the second part of your question here. Oh, wait a minute here. Aha, there it is. Boy, that wound up really late. Verified by Genova Diagnostic Comprehensive Stool Analysis. Mycology reported of, let's see, Rhodotorula. So medicine is a foreign language, isn't it? At 3 years old, she was treated with 3-month course of antibiotics and fluconazole. Prior to identifying the Rhodotorula as the culprit, she's had digestion issues since birth. Her treatment for Lyme, let's see if I can find the next thing here, and yeast overgrowth likely contributed to the development of SIBO. After the SIBO diagnosis, we put her on a low FODMAP diet and have recently removed all fruit from her diet. She has failed 1 round of oral rifaximin. She has taken a variety of herbal formulas and to help with the fungal overgrowth, but we seem to be at a standstill and have stopped making progress on any front. We feel like we are playing with the whack-a-mole, unsure of what to treat and when to treat. Is there an illogical approach we are missing? Thank you for everything you do. Boy, that's a lot. To be honest with you, Marcelina, it's hard for me to say. I need a lot more information, even from what you wrote down. You wrote down a lot too. I would suggest we actually do a one-to-one consult. There's more questions I need to ask regarding Lyme, what symptoms she's having, to try to help you figure out where to go. And I don't think I'm going to do justice to giving you an answer in this kind of a setting. Okay, all right. So look at that one-to-one consult as an option. I'd be glad to help take a look at that with you. Okay. All right. Thanks for that question. I'm sorry. I think it would be better if we handle it a different way. All right. So listen, everyone, that's it for me for tonight. I'm going to be back here again with you next week. In a second here, for those of you that are still here, I'm going to send you over. I'm going to redirect you back from your computer to the Treat Lyme book. And from there, you can read over any of those articles that you want to. You can sign up for next week's webinar, okay? Or you can wait till tomorrow morning's email when you'll have a chance to click on the tab to sign up again too. But I hope you join me next week. For those of you that like this work that we're doing here, I hope you support me. And to do that, it would help if you actually subscribe to the Treat Lyme book, which I think would give you some great information as well too that can help your care. All right. So and to subscribe, what you basically do, click on an article you want to read, and there's a box there that's going to say buy now. Click on the buy now button. That's how you'll be able to subscribe. All right. There will be some updates coming within the next month to the Treat Lyme book. I've got a talk I'm giving to a Lyme conference in about 2 weeks. It's going to be taking my time. And then after that, I want to refocus on writing some articles about persister Lyme, including dapsone, and some options that people have around that. So look for that. But that's probably about 2 to 3 weeks in the offing before I have time to be able to devote to that again. All right. But in the meantime, good luck, everyone. I look forward to visiting with you next week. And I'm going to go ahead and redirect you over to the Treat Lyme book now. Good night.